Welcome back to Soda City Living. We're excited to start a new series today with MUSC Health. In our first segment, we head up the road to Blythewood, where a new health clinic is welcoming patients of all ages. It's MUSC Health Primary Care in Blythewood. You'll meet Dr. Dion Foster, a Midlands native who found his way back to the area after going to college and medical school in Charleston. We'll learn the importance of primary care, when you should visit, and why you should establish a family physician. Dr. Foster will also share why he loves what he does. Here's a look.
Let's talk about your blood pressure. I always had a natural curiosity and interest in science, but after some time passed, I realized that I was really passionate about helping people. So I combined those interests, and medicine found me. And through one journey or another, I ended up here today practicing medicine in a community that I love and that I love to be a part of. So I'm originally from the Columbia area, the Northeast Columbia area, and just having spent time in this community specifically, it was important for me to come back and contribute to this community. I spent a lot of time working and training down in Charleston with MUSC, and when the opportunity came back to serve Blythewood with this area growing and developing the way that it has been in the last handful of years here, it was a no-brainer, and it's been a wonderful opportunity, and me and my staff are very happy to be here and to be a part of this community. People come by shopping locally at different shops and grocery stores, and they peek their heads in, and one thing leads to another, and they're on the schedule, and they bring their families back and significant others, and we've really grown more or less by word of mouth. And it's been really great, and the reception's been very warm, and we're all very thankful. Here in our clinic, we provide primary care services for most adults and older patients. That's your everyday sick visit needs. If that's a stubbed toe or a runny nose, we can take care of those sorts of issues. Viral disease testing such as COVID, RSV, flu testing, we do a lot of that in addition to vaccines, but also coordinating care for more complex patients. If there's a lot of specialists involved with our healthcare system or with others, we really pride ourselves on helping to coordinate those efforts to make sure that nothing is, from a healthcare standpoint, is slipping through the cracks in between your visits with various specialists if they are involved in your care. Just with the changes of life, it's easy to miss out on the next important healthcare screening or the most up-to-date vaccine or the most recent guidelines that come out for whatever your healthcare situation may be. As primary care doctors, myself specifically as a family medicine doctor, we pride ourselves on making sure that those gaps get filled, and that if there are any complications or questions that come up on the patient's end as far as any confusing information that may be out there, that we're addressing all of those concerns. But I always like to remind patients that we're here specifically in primary care for you, the individual, overall as a whole, just to make sure that there's nothing going on that we can't handle to help you live the highest quality of life possible, which isn't always necessarily meaning that you need a medication or a procedure. We want to just talk to you and make sure that you're doing okay, and if you're not, that there's anything that we can do to help out with that we're definitely doing that and plugging in with the right resources to make that happen, which is why it's great to be a part of MUSC, because we have so many resources both here in the Midlands area but also across the state as well. For patients who may not be able to physically make it in, we also offer telemedicine as well. So assuming that you have a working smartphone or computer access with internet capabilities, we can shoot you a link to set up our telemedicine software, and we'll be able to take care of whatever issues may arise that way. So here, right at the moment, I'm the only provider here in our office. We have a wonderful certified medical assistant who helps us out as far as doing blood work and lab work here in-house. We have a referral specialist that helps coordinate the scheduling of referrals with different medical specialists from cardiology to endocrinology and the like, as well as our office manager who also helps with the coordination as well. So primary care is a bit of an all-encompassing term that speaks to more or less the general kind of healthcare needs that most patients would receive on a day-to-day basis. And there's different kinds of doctors who can go into primary care work: internal medicine doctors, family medicine doctors, even pediatricians, more so for kids and adolescent age patients, they're also considered to work in primary care as well. By training, family medicine is a specialty that's designed to take care of patients, we like to say, from cradle to the grave. So by training, we can take care of small babies and kids, middle-aged adults, geriatric population, and some even pregnant patients as well. I love the people. I love having conversations with all kinds of folks from different walks of life, different socioeconomic backgrounds. I love just talking and being a part of their lives, and I'm so grateful for every patient who allows me to be a part of their lives and to be a part of their healthcare team.
We want to thank MUSC Health Blythewood for hosting us and Dr. Dion Foster for teaching us about what he does as a primary care and family medicine physician. We'll check back in with MUSC Health next month for another helpful segment. Stay with us. We'll be back after the break on Soda City Living.